Well, from us as a small business, we're trying to just figure our way through this. Right now we have plans in place with our employees, and based on where healthcare costs are going, we're going to have to revise our plan. And so the question is, what is the best way that we can revise our plan without jeopardizing our key employees?
Okay, so there's a lot that comes positive as a result of healthcare reform and the certainty that came from the election, and that is that often in the restaurant space we're really trying to figure out a way to make healthcare affordable for our employees. And the existence of a public exchange gives us an opportunity for that premium to be highly subsidized. And because the benefits are a function of their income, those employees are going to be able to get better than what we can provide today at a cheaper out-of-pocket expense for themselves. But that all has to be really integrated with the way we operate a private plan for the majority of our employees who may not be able to get a subsidy.
I think my biggest concern, unfortunately, it comes down to the money and not knowing why so many people are not enrolled in our plan today that are eligible. Trying to get to the bottom of what that impact's really going to be is, a big concern for us.
I was telling a group, was it yesterday or this morning, that I have this reoccurring dream. I don't know if you have this, that I'm in my senior year in college and I have a math exam and I haven't been to class all semester and I don't know where it is. For some reason, it's always math. You have that too? Okay. Maybe we weren't in school together. I don't know. So, I read that that's a common dream and that it stems from having too many things on your plate that you're concerned about that you're not on top of. And so if you're having that dream today, it's probably about healthcare reform, probably. But the reason I want to encourage you to get started is it is a huge elephant that is going to take a lot of bites. The quicker you can get started on it, the quicker you can start to understand exactly the quantifying impact it has on your organization and what sort of organizational change you may or may not need to know, and it will reduce the stress level about compliance greatly, not just for you, but for your entire organization. Trust me, your employees are concerned about your decisions, and they're probably already asking you when they get their free insurance.
So, organizations are really struggling with figuring out how to comply with the healthcare reform law, trying to decide individually whether it's best for them to terminate their plan and pay the fines, whether it's affordable to offer coverage for all their employees, trying to decide if it's best to start to reduce hours and hire more part-time people, or to design a plan that really meets everybody halfway so that they can afford to comply with the law but not disenfranchise their employees. So for most of the organizations we're seeing, it's best if they can structure their plan to still provide coverage for their key employees and allow some of their lower paid folks to access the subsidies and the coverages through the private and public exchanges.